Hi, everyone that was able to join us. I think I've met most of you. I'm Rachel Abrams. I am the Fear-Free Certified Practice Manager. So thank you very much for joining us. As I mentioned just a moment ago, this webinar is being recorded, and so it will be posted on the website following this evening. So if you have anyone that wanted to attend and wasn't able to, they'll be able to watch it after the fact. So I'm going to go ahead and introduce our esteemed panelists, and then they're also going to give you a little bit more information about themselves, and then the floor will be yours. So hopefully everyone knows Dr. Becker. Dr. Becker, wave your hand, say hello. Dr. Becker is, of course, the founding father of Fear-Free. So thank you, Marty, for all that hard work. We're also joined by Dr. Conrad. Dr. Conrad is a graduate of University of California, Davis. She has joined us as really an expert in this matter. She is the founder of Paw Project. I'm going to let her talk to you all a little bit more about that, but the main goal is to educate and help make legislative changes that make declawing cats illegal. So thank you, Dr. Conrad, for joining us. We also have Dr. Michael Petty, who, as you can see by all the initials behind his name, has done a lot in his career, including published books, I believe. Is that correct? You got some books out, and you are one of the owners of Arbor Point Veterinary Hospital and Animal Pain Center in Michigan.
Yes.
Okay, great, thank you. And we're looking forward to hear a little bit more about that. And last but definitely not least is Dr. Valarie Tynes. Again, some of you may know her from her role with CVA. She is a boarded veterinary behaviorist, but prior to that was in practice for more than a decade. So lots of real world experience before pursuing that board certification. So I'm going to turn this over to Dr. Becker to tell us a little bit more about the decision Fear-Free is made to eliminate the Declaw services from our Fear-Free certified practices. So take it away, Dr. Becker.
Well, thank you, Dr. Abrams. I might sound a little more subdued than you're used to me being. One is we lost my mother-in-law last Thursday, so a week ago to today. And it's been a really tough loss, very close to her. That was my wife's mother, and we lost my wife's brother in December. So 2 deaths, 5 months apart, but I'm also in a hotel lobby, okay? And so I couldn't get on in my room. So if I sound a little muzzled here, I'm okay mentally. It's just dealing with a loss and being in a hotel lobby. I went to veterinary school to be a dairy practitioner. And that dream had taken me from age 7 to I was 21, I think, and I went to veterinary school, 21. And within the first half hour of veterinary school, the dean gave a talk on the human-animal bond, and I became a companion animal practitioner dealing with shelter pets. And growing up on the farm in southern Idaho, cats lived in the periphery of the farm, in the shadows of the haystacks. We had no house cat. And like many rural things like that, there'd be lots and lots of kittens and cats, and then there'd be none, I think, when waves of panleukopenia came through. One big old black tomcat. My gosh, he had a neck like Mike Tyson, and a throaty old growl, sounded like Don Corleone. But he, I don't know how many different fights he'd survived, but the kind of issues of feline care really didn't have anything to, any knowledge of it. And even in the veterinary hospital I worked at before I went to veterinary school, their cats were very, very infrequent in the veterinary hospital. It was a mixed animal practice. So I graduated in 1980 from Washington State University and went into partnership with somebody. And basically, you did as you were told. So we did convenience euthanasia. I didn't know what convenience euthanasia was, but basically they'd bring in a litter of kittens or cats or an elderly dog or a young cat and pay you to put it to sleep. And we did. I don't know how many I did, but a lot. Ear cropping. I had a little miniature schnauzer that I got in veterinary school. And Dr. Robinette, the surgery teacher, had me helping with the surgery. And somehow that ended up that people thought I was really good at ear crops, which I wasn't. but I did ear crops, which I regret every single one that I ever did. And I can't tell you how many cats I declawed over the years. People come in and ask for it, and you did it. So it's either people wanted you to do it and you did it, or you were told to do it by the practice owner and you did it. I still think back of all those pets that we did, took teeth out, used that root elevator and dug and dug and dug in those gums with no analgesia. Mike Petty's probably, sick right now thinking about what we did, or the hit by cars that would come in, or the dogs or cats that have been mauled or run through the fan belt. No anesthesia, or no analgesia, excuse me. But over the years, things changed. I think you'd be hard pressed to find a practice now that did convenience euthanasia, where people just bring pets in and you euthanize a sack full of puppies or kittens. I don't think very many people are doing ear crops, those kind of cosmetic surgeries that are for no reason other than just the pet's mom or dad that wants it. And the thing with declaws, I have been following this for a lot of years and was personally against it. But it took time to really research it and look at the pain and the animal welfare issues and the behavior side. And when you look at fear-free, we talk about taking the pet out of petrified and putting the treat into treatment. Everything is about the physical and emotional well-being of pets. And how could we, if we're concerned with the physical and emotional well-being of pets, still recommend or do declaws of cats? I had a life-changing conversation with Dr. Conrad, who you're going to hear later today. And in some of her tonight, but in some of her comments, there was really no scenario that I could offer that she didn't have an answer for. Let's talk about an elderly hemophiliac that's undergoing chemotherapy that wants to declaw their cat. I'd be a little bit facetious, but here's a colleague of ours that has taken this as a personal mission, no pun intended, but you'll be really intrigued to hear about her journey. So I'm going to end there. I want to defer to the experts. We're so lucky to have a boarded veterinary behaviorist in Dr. Tynes. There's about 100 of them. And when you talk about fear-free, that is the bedrock of fear-free. Boarded veterinary behaviorists are the bedrock. They're the ones that have the education, the training, and the experience. Dr. Petty is a world-renowned pain expert who, again, took a position against this very early on. And then you're going to get to hear from Dr. Conrad, who, again, in one phone call, I had a life-changing moment similar to what happened when Dr. Karen Overall, the boarded behaviorist, gave me a transformation, the emphasis that started fear-free. So I believe I'm going to turn this over to Dr. Conrad.
Thank you, Dr. Becker. It's always such a pleasure to hear your story and how you have changed veterinary medicine by leading the change yourself. It's an honor to work with all of you. I am Jennifer Conrad. I'm a veterinarian. I went to UC Davis, and as a young veterinarian, I was taking care of big cats, and many of them were declawed. And I thought, what is going on here? And the more I looked into it, the more I realized that it was something that everyone accepted, that declawed cats, big cats, were going to be lame from it. And I thought, well, I'm a veterinarian. I'm supposed to do something about that. So I started repairing their paws, and it was really almost like evangelical. It was like heal, and they would come out of the surgery and they could walk, and they were so much more comfortable. And within days they were running, and it was so gratifying to give them back their lives. And one day I started talking to people about their little cats and how they had been declawed, and I thought, well, why can't we start doing this for little cats? And that's really how the Paw Project was founded. I think that the more that I look into this, the more that I think there is absolutely no good reason to declaw a cat. And I think that most veterinarians know that in their hearts somewhere. They know that they shouldn't be doing this. It's the amputation of healthy tissue that has absolutely no benefit for the cat. And I hear these arguments that, oh, I'd rather do it because I do it better. Well, I don't think that that's a fair argument, because just as you wouldn't, if someone came into you and said, hey, my dog is doing this behavior, like jumping up on the couch, would you remove its legs? No. Just as, and the other extreme is that if a client comes into you and says, hey, I need Clavamox, you would be like, no, you have to let me make that decision. So I think that as veterinarians, we have to take back veterinary medicine and say, hey, we're pediatricians. We're not tailors. We're not going to just do what suits you. We are pediatricians for animals. We're the doctors. And there is no good reason to declaw. It doesn't keep cats in their homes. Just ask any shelter how many cats are in their shelters who are declawed. And statistically, when you look at places where declaw bans have come into effect, the relinquishment rate of owned cats has gone down markedly, and the adoption rate has even doubled in some cities. So it doesn't save lives. There's no reason, as Dr. Becker said, for the hemophiliac with autism to declaw the cat, because there are hemophiliacs with autism, I suppose, living everywhere in the world. So why do you they don't modify their cat, they don't declaw their cat. So why are we saying that that's something to do? Plus the Hemophiliac Society of America says don't, and the Autism Society says don't. So why are we making this up? I think that even with laser or the most extraordinary pain management, there's no reason to do this to an animal. And I am so proud to be part of this movement, to move fear-free into a no declaw status, because then I think fear-free is leading the whole world on the idea that these are individuals, we are pediatricians, and let's do this together. Let's take back veterinary medicine, not make it client-driven, but make it the well-being of animals driven. Thank you so much for listening to me. And now I'd like to introduce Dr. Michael Petty, who is also a Paw Project veterinarian and a huge advocate for animals and the fact that they do feel pain, and let's do everything we can to stop them from feeling pain. Dr. Petty.
Hi, thanks. Well, I'll try to bring a few things to the table here, but basically my background is I've been a general practitioner my entire life, and have always had an interest in pain management. And I can remember when October 1996 Rimadyl came out, and it was just such an exciting moment. And it helped, you know, I think one of the things that I really discovered was that people are very interested in whether or not their animals are in pain. And we thought, you know what, let's like start offering Rimadyl as an adjunct to therapy or to surgery and see if people want it. And we'll offer like $15 and we'll call it postoperative pain management. And, you know, after about 4 months, when not a single person had said, no, I'm not going to spend that money, it was a real aha moment for me, how interested people are in pain management. And I think if people really knew with cats, you know, the possible long-term effects that so many of them have, not even to think about the short-term effect of the recovery from the surgery, they'd have a different attitude about it. And, you know, it's partly incumbent on us to really bring this to the population. And the more veterinarians that talk the talk, the better it will be. And I, like Marty, I used to do declaws. I did a lot of them. And one day I was like, why am I doing these? I hate doing them. The cats don't want them to get done. The cats hate coming back to the practice after they've been declawed. And partly it was like, you know, I think everyone in the back of their mind, it's, you know, so this is going to maybe impact me financially. I was probably doing 3 or 4 a week. But, you know, you have to have the courage of your conviction. You have to say, you know what, this is something I believe in and I'm willing to take a financial hit. Well, guess what? It wasn't a financial hit. I've actually had people come to my practice because, you know, on my website, I tell people we do not do declaws, and people are like, yay, a champion. I'm coming to see you, not my regular vet. So, you know, the things I was afraid of, you know, it wasn't a big deal. So I hope I'm not going to go on any longer. I just hope that if people are having those kinds of thoughts, I'm the guy in the trenches. I've been practicing now for 41 years. And out of that 41 years, I've owned my own practice for like 35, 36 years. And, you know, I've handled it, and I've thrived with not doing declaw. So that's it. So Dr. Tynes, you're next. And thank you for hearing me out.
Thank you. It's nice to hear the input from you guys, because I'm not so sure I have a whole lot to add, except just to tell you a little bit about myself and where I come from. So I've been in practice more than 30 years, and I come from that same generation where we didn't have a lot of analgesics, and we didn't have a lot of the options that we do today for treating our patients. And even though I did not learn how to do declaws in vet school, they weren't even teaching them to us then, I did a lot of them. And I will admit, both of my last 2 cats were declawed. It was many years ago, but they were declawed because I didn't know any better. And one of the most vivid moments that I still have, and this was back when I was in vet school, was I took my cat to be declawed at the veterinary school. She was declawed by a veterinary student. This was when I was probably first year, so I didn't know anything. But a few days later, when I watched her try to jump up on her favorite chair, hit the chair with her front feet, and literally just fall backwards onto the ground, thunk, and sit there like, what happened? That is emblazoned in my mind, and I never forgot it, and shamefully still went on to do declaws. But the most compelling moment for me that happened probably 14 or 15 years later when I was doing relief work was overhearing a receptionist tell a pet owner who was asking about declaw, obviously, that, oh, it's not a big deal. It's like getting a really close nail trim, like getting quicked. And that did it. That was when I realized this is not right. We are not educating people. We aren't being the spokespeople for the patient that we need to be. And it was a very profound moment for me. And since then, I have said this is something we need to quit thinking of as a routine surgery. Someone needs to step up. So I'm excited about, Dr. Conrad, because even the AVMA, when they changed their policy, changed their position statement, it's very weak. I was kind of embarrassed. And animal welfare means enough to me that a few years ago, I also went back and got my animal welfare credentials, because this was something that I felt enough people weren't speaking up about, among many other things, of course. But every time I hear veterinarians complain about not being able to do this, as Dr. Conrad's already suggested, what I hear are a lot of excuses that aren't backed up by data. They're just people's anecdotal responses. And I think now that we have really good data to demonstrate that cats likely do experience chronic pain from being declawed. And if you think about the fact that we still aren't very good at even identifying pain in cats. And I always have said, let's err on the side of our patient and expect if it would cause us pain, why wouldn't it cause them pain? So there's so many things we don't know about how they experience pain. Do they experience phantom limb issues? There are too many questions, and we need to be erring on the side of the animal. So other countries have banned declaws, and the world hasn't collapsed. The roof hadn't caved in on them. Their shelters aren't full of abandoned cats. Again, we need to quit following and lead the way. And that's what I think is so wonderful about Fear Free, is those of you who have already become Fear Free certified practitioners and Fear Free certified, had your hospital Fear Free certified, you are clearly committed to raising the bar on practice. So to me, this is just the next step. Fear-free, this is an opportunity for Fear-free to keep raising the bar, to set the standard for what should constitute good animal welfare in practice. And I think if we lead the way, if we talk the talk and walk the walk, we can see change. Maybe slow, but I think we can lead the way and see that change. That's all I have to say.
Thank you, everyone. We have, I think, over 100 years of cumulative experience brought to the table, which is just fabulous. So, all right. So with that, it is time for our attendees to give us their questions, their concerns, whatever is top of mind. I feel like you guys should be able to raise your virtual hand. Yes. Okay. Dr. Young is raised. Okay. Wow. Okay. So they know how to do that. Okay. I know Penny, you had asked a question in the chat, so I'm going to have you go first, and then Dr. Young, I'll have you go next.
Okay. Can you hear me?
We can.
Oh, yay. So the only reason I asked the question in chat about tendinectomies is because I had worked at a cat hospital where we did declaws and did tendinectomies. And I was just assuming that that is still as painful and still affects their gait and their limbs and their ability to stretch. And so that we would just figure that as damaging as declawing.
Dr. Conrad, is this one you want to take?
Well, okay, well, first of all, you are right. And second of all, even the AVMA is against tendinectomy. So if the AVMA is against it, you know that is probably something that we really shouldn't be doing. Here's what's so funny to me about tendinectomies is when you do a tendinectomy, for anyone who doesn't know, it's just you're cutting the tendon so that the claws are like oven mitts. You have to cut those nails every 2 weeks to prevent the nail from growing around into the pad. So if you can cut the nails on the cat every 2 weeks, why do you want to do the tendinectomy? I mean, isn't cutting the nails on the cat every 2 weeks exactly what you should have recommended without the surgery? Does that answer your question? You're 100% right. It's wrong.
Yes, and I've become the cat person, and because I worked in this cat hospital years ago, and now that was in Florida, now I'm in Virginia, and I've made it my point to learn as much as I can about cat behavior, help people with other options to declawing. You know, how do you train that kitten? What kind of damage do you do when you do declawing? And I have to say, I'm really proud of the clinic that we're in, because even long before we became a fear-free certified clinic, nobody ever said, yes, we do cat declaws. I mean, I was just welcome to tell people what their options were and that they would have to go someplace else if they were going to get it. So that's 6 years that I have had extremely few people even calling for declaws, which I think is amazing.
Yeah.
And then to be able to have the ability to give them other options or tell them no.
Yeah. All right. Great. Thank you, Penny.
You're welcome.
And let's hear from Dr. Young.
There we go. Sorry. I'm not good on Zoom. So I'm basically being the devil's advocate because, again, I've been in practice 40 years. So I come from that old school. And I'm in a small Midwestern town. And so there are a lot of vet clinics that do declaws. And we don't do very many. But the exact thing happened that a 80-year-old hemophiliac adopted a kitten from the animal shelter. We talked about trimming the nails and behavior and all that. And, you know, mentally she wasn't totally there. And so it's a very hard decision because and I understand this, I'm just groping with it, because she will go someplace else and get the declaw done. She will. There is no doubt in my mind that she would. So taking the attitude that theoretically we will do it as painlessly as possible and do the local anesthetics and all that kind of stuff, which will not happen at these other vet clinics. I know that. So help me on that kind of situation. So we do not encourage at all. We work so hard to talk them out of it. But when you know that they are going to go someplace else, help me with actually a little bit of the moral dilemma there.
I think that question has Dr. Conrad written all over it.
Well, I understand what you're going through, because as a veterinarian, you get clients who ask you for all sorts of things. And as Dr. Becker had talked about, euthanasia is one that is probably the most heartbreaking, because you know that they're going to go somewhere else if you don't do it. But at the same time, I really believe if you take the time and to say to them, look, these are your options. There are options. And as a hemophiliac, you might think that you're doing yourself a favor by declawing the cat, but really in reality, you're giving yourself a false sense of security, because it is pretty well known among groomers and vet techs and all sorts of us in the veterinary profession that declawed cats often blame themselves. I mean, they can't protect themselves, so they might bite. That's what my experience is, that they bite. But also, I don't think that you want to, you don't want to become the hands of what your client wants. You never would do that in regard to what antibiotic to give or anything like that. So I know that it breaks your heart to think that they're going to go down the street. But I think if you educate the client well enough and she still goes down the street, then there's not much you can do about it, but you haven't participated in doing something wrong. Because the way I see it as a veterinarian, you're going to make enough mistakes by accident. Don't make any on purpose. That's how I try. That's how I tell vet students all the time who are in the same position you are.
Thank you.
I think it's also a potential service that could be added, sort of, a lot of practices are doing wellness type plans. Like, is there a technician or two that would go to their house every 2 weeks and do the nails? It's something that benefits all parties involved. But Marty, you had your hand up too. I muted you, Marty. Can you unmute yourself?
There we go. You know what else I did? I used to do. I only did a couple. I debarked 2 dogs because people wanted me to do it. I'm a lousy surgeon. It was not a good thing for me to debark a dog, but they wanted it, and the practice owner, you did. I just think back of that part of my life. I had a cat. I'm back practicing again. For COVID, I took the whole time off. Had family members with COVID, but I'm back in practice. I had a cat last week that Tuesday, a couple days before my mother-in-law died, that had bitten. There's 5 veterinary practices in Sandpoint, Idaho, 6,500 people. And they're all multi-doctor practices. And you think, how is that possible? Well, you make a lot of money on the western side of Washington State with Amazon, Starbucks, Boeing, Microsoft, Costco, and it's a very short flight or a 6-hour drive to Coeur d'Alene, Idaho, and Sandpoint, where real estate's a lot cheaper, and it's very nice. This cat had bitten a vet at 5 other practices, and so we'd never seen the cat before, so no pre-visit pharmaceuticals, right? But it comes in, and this cat, a big boy, probably 24 pounds actually. And it was obvious when starting the exam that he was very sensitive around his feet. So, one thing I learned about Fear Free, in the past, there was nothing that couldn't be solved by having more techs pile on a pet. If so, you know, you could pile enough on, you could get the procedure done. And now we follow a philosophy that I first heard by a veterinarian named Dr. Julie Reck in South Carolina that says, I cannibalized her words, is we're not going to sacrifice your pet's long-term emotional well-being for the convenience of getting this done today. So this cat, we had the option, I told him the three options are another day, a different way, give it something orally and see, give it an hour, or go straight to something to calm it. I don't say sedate, we say to calm. He chose to come back another day. So she came back the next day on a non-steroidal anti-inflammatory, Dr. Petty. And it was unbelievably different in this cat. Matter of fact, they were talking that morning how energetic the cat was. And it was like, God, it's like crazy. Like he was excited to come back and see you. Well, they don't know. It's just the relief of pain. So I thought that was really, really interesting. And also as it relates to decline, we had to make a decision at North Idaho Animal Hospital. This is where Fear Free started, literally, right after that first interaction I had with Dr. Karen Overall. So starting in 2010, we don't do nail trims on dogs without something to calm it, period. We don't. And so if you talk to people, we need to give it something to calm it. You'll have people that say, by God, I've had dogs for 40 years and I've never given anything to do it, or dog blank that used to be here, he just did it. I don't care if it upsets it. I just want to get it done. But we just think I'm sorry, but we can't do it. We can't put this pet, its well-being at risk. That's not what we do as veterinarians. We can't put the safety of our staff at risk. There are other people in town if you're set to do it, but for us, we always do things with something to calm it. So you will lose a few of those people, but so many people hear about the way you treat it and come back, you more than make up for it. And we've actually had people, many people that have left for certain procedures and then come back and realize they'd made a mistake. When they really start to see the signs of that pet struggling, or the pet's taken away and they hear something back there, they realize that's not the right way. So I want a friend of mine, Scott Campbell, you may know his name from starting Band Pet Hospital. He said one time, and I remember this, you can be accused of charging too much, of missing a diagnosis, of being late for an appointment. There was 2 or 3 other things, but you can't be accused of not looking after the pet's best interests. I think that's the bedrock. If that's not the pet's best interests, we can't do it. But Karen, you're very articulate, by the way. I love him just in the way you asked that. It was very, I applaud you asking that and how articulate you were. That's a real world situation that happens all the time.
Right. Thank you, Marty. Dr. Downing would like to share something about tendinectomy. So Dr. Downing, please. Yeah, the floor is yours.
Okay, there we go. So first of all, thanks so much for hosting this. I was really impressed to see the event scheduled and the panel, and it's really a privilege to be here. And thanks for unmuting me and letting me speak for a minute or two. Actually, a couple of things come to mind. I had first wanted to make a comment about the idea of tendinotomies and tendinectomies from a biomechanical perspective. So as a biomechanist, boarded in the College of Sports Medicine and Rehabilitation, this is part of my jam now. I think it's important for all of us to realize, recognize, and remember that when we alter the biomechanics of the toes of a quadruped, we actually alter the biomechanics of the entire body. And what that causes ultimately is joint dysfunction upstream. So in this case, in every joint from the metacarpophalangeal joints to the carpus, to the elbow, shoulders, and then very importantly, along all the facet joints in the spine. And if you have been paying attention, you know that in cats, the place that osteoarthritis typically first manifests itself is actually in the caudal spine. So in the lumbosacral junction, the sacroiliac joints and the sacrococcygeal joints. And these cats who don't move normally alter the biomechanics of their lower spine in a way that can actually accelerate and amplify the development of OA in those places. So that was point number one. That had to do with the tendons. As for the procedure, I have been beating a drum for a very long time that part of the dilemma we face as veterinarians is that we have embraced this sanitized term of declaw, which people do not understand. And in my practice, where we gave this up decades ago, the real turning point was articulating that what it is feline toe amputation. And the minute we began speaking about it in that term and using that phrase or that term, feline toe amputation, the first reactions I got from clients were just, they were aghast. I mean, many of them just sat across from me and their jaws dropped open because they had no idea what we were actually talking about and what we were doing. So educating, as you've articulated so well, Marty, this idea of just helping our clients know that our job is to act on to the best interest of our patients, and of all the things we can do and of all the things we can screw up, because we're all human, this is the one thing that we should never lose sight of as our North Star, which is acting always in the best interest of the pet. And I think that's my story and I'm sticking to it. Thanks.
Thank you, Dr. Downing. I know Penny has another question. Before I get to you, Penny, I just wanted to share actually Jasper's story. So Jasper was rescued off the side of the highway, and so he was about 4 pounds when we found him. So his interaction with humans had been probably pretty limited, and I, had to clean his ears, I had to do his nails, which we did very slowly, which we did with clicker training. He's also one of the most easily motivated by food cats I've ever seen. So it's actually created a little bit of a problem in that if he hears anyone else's nails being done, another cat's or mine, he comes running. So I think part of this equation is most of us have not had that experience and assume that cat nail trims are always going to be difficult. And that's not necessarily the case. We had ended up finding another cat after him, and he's now the same way. So now I have 2 come running when anyone's nails are getting done, to the point where when we went out of town this week and the first thing I did was start clipping my nails, and my husband's like, really, that's what you're going to do? And I said, I can do it without being mauled by cats. He's like, oh yeah, that's true, because they just associate that sound with like yummy food and stuff. So it is very possible. All right, Penny, you are up.
Before you go on, if I could just make a quick comment to support what Robin said about the biomechanics. And, when we have both dogs and cats that come in that are having issues with walking, one of the first things we do is look at their nail length and trim them back, because if they're overgrown, it actually gives them a sense that, not a conscious sense, but their body tells them, I'm walking uphill and I have to change this because my nails are hitting before the rest of my foot hits. So, what effect does that have when there's absolutely no nails? And so yes, the biomechanics are definitely screwed up.
Thank you, Dr. Petty. All right, Penny, I think you're already unmuted. Yes, we can hear you.
You can hear me? Okay. So I did make the snarky comment that if people really want a declawed cat, they can adopt a declawed cat. They don't have to do it themselves. But I had a question, Dr. Petty, Dr. Becker, when you were talking about realizing that big boy was potentially painful in his feet, and that's why he was being sensitive. So did you use something like meloxicam? Because I'm thinking our go-to is always gabapentin. And when you said that, I was like, oh my God, if this is a pain issue, then maybe we don't have to go with the gabapentin, you know. So I guess I just want to have you expand on that a little bit.
By the way, I'm glad my wife is not here because she hates it when I say this, but I am a below average veterinarian. just at the clinical side, that's the truth. I mean, in the exam room, I love the exam room. I love pets and people. I'm pretty good at diagnosis. So I give myself a good score there. Back in the back, when you got these difficult cases that, you know, the VIN cases, you get out your 10th edition to Ettinger, you think about calling somebody at the university, you huddle with somebody in the practice, not very good, well below average. Maybe I'll give 4 probably. Surgery, oh boy, 2, and that's being generous. The typical stuff, the spays, neuters, laceration, okay, but I was just not good with tissue planes. And I don't think this is here Dr. Oz calls me as America's veterinarian. I don't believe I've ever looked in the ophthalmoscope in a pet's eyes and seen pathology. If it's got an abrasion or a foreign body or distichiasis or plugged tear duct, but looking in there and going, oh my God, it's blank. If I ever did it, my 68-year-old mind has forgotten it, but we have a multi-doctor practice and there's some people there that are really good. So we actually did use meloxicam with some gabapentin, and Mike will probably kill me for this, and I need to probably learn more from him, but it was a very small dose, but it was unbelievable the difference in that cat. So Mike, you're the expert.
So yeah, meloxicam works really well in cats. Strangely, it causes issues in the United States, but not anywhere else in the world, right? And that's because they use very small doses everywhere else. So yes, meloxicam for the, acute pain, the chronic pain, the inflammation, gabapentin for the neuropathic pain. And, as anyone who's a cat practitioner needs to be excited about the monoclonal antibodies that are coming out. I've had the opportunity to use them in my practice and they're like fairy dust. I mean, they really do a good job. And I think, we'll see, I don't know. I have no inside information. Zoetis is very tight-lipped about it, but I suspect that maybe by the end of the year we'll have it. I think it's called Silesia in Europe. They've got a positive review on it. So that'll be another thing that we can use. But, I got to stop because I'll just go on and on and on about pain management all day. But yes, meloxicam is good. Contrary to popular belief, it is safe in most cats that have kidney disease. In fact, because that's sometimes the reason you don't use it. There was one study that showed that cats with kidney disease that got meloxicam lived longer than cats with kidney disease that didn't get it. So think about that.
Yeah. Thank you, Dr. Petty. And that study was in Australia, I believe, out of Australia.
Or maybe England, Great Britain.
So I did want to just mention ISFM had published the guidelines on NSAID use in cats. It's been several years ago now. But one of the things in there was a very nice generic client handout about using NSAIDs in cats. So that resource is still out there, but it's a very well done one pager, like this is what an NSAID is, this is why we're choosing to use it. These are the things that we want to look out for. So don't feel like you have to reinvent the wheel there. So. All right, well, we have still all of our attendees with us, so thank you for that. Does anyone else have any questions or comments for us in our esteemed panel? Dr. Tynes, Penny had another question about Feliscratch. If you can comment, say what you can about that. She's just asking what people's experience with that has been.
Mm-hmm. And I would certainly love to hear people's experiences with Feliscratch. For those of you, though, that may not know yet, Feliscratch is no longer available. So it's probably, and along the lines of what we're talking about here, the most crushing blow I have experienced since I've been working for SIVA for the last 6 years was when they told us that Feliscratch was going away. And even though it has, I think, really nice data supporting its efficacy, for what appears to be the case is it was not a good product to put over the counter, because when pet owners could just buy it wherever, apparently there is a big history of them using it inappropriately and then being very unhappy with it. So you could go on Amazon and you could see all these negative reviews of Feel Scratch, which doesn't help, of course. And it didn't get out to enough people. That saw the efficacy, even though the veterinarians I talked to saw the efficacy and loved it. So my dream is to get that product back. I don't know if that would happen and when, but let me tell you, I will not stop asking them for it.
I'm really happy.
As long as I have breath in my body.
I'm happy to hear you say that, Valarie. Robin Downing here. I was horrified to hear that it went away because it has been such a useful tool. So I actually bought up all I could get and stockpiled it and have it as like a secret stash, and you have to like know the secret knock and the code word and all of that. So I'm glad to know there's someone on the inside advocating for its return. And I just want to make one last comment about how proud I am that as an organization, Fear Free has embraced this very direct and very important position of just basically doing the right thing for the right reason by articulating that feline toe amputation just needs to go away, and it is incompatible with actually being in any way, shape, or form committed to the principles and practices of fear-free medicine. So thank you for that.
Thank you, Dr. Downing. And you heard it here first. Dr. Downing has the speakeasy for Feel Scratch. So yeah. I did want to add to this conversation. I remember, when I was in practice and talking to new cat owners, be it a kitten or just a new adult cat to our practice, and talking about giving the cat choices of scratching and vertical or horizontal. And now that I am the proud / embarrassed owner of 5 cats, and also have developed an abnormal affliction for buying cat stuff, I've been very surprised to see how many different types of surfaces they like, including the ramp style, but also that I have 3 that like to be headed down first on the ramp style so that their butt is higher than their head and scratching that way. So Marty has seen a virtual tour of my house, and what did you say, Marty? I've never seen so much cat stuff. It's a problem. It's gotten worse during quarantine. But yeah, I mean, I have them in all shapes, sizes, textures, and they use them all. Oddly, one of their favorites is a yoga mat. Love to shred those up. So I think that's an area for us as well, is really kind of pushing the boundaries of what scratching options are offered to cats, and understanding that not only up or down, different textures, but various angles. I have a round one that's because it's a tunnel that they can sit into. I would love to get on that thing and scratch. And I'm hoping I don't need to do anything with my computer, because Jasper's fallen asleep with one hand holding his butt and the other holding his hand and front paws. So you guys have lulled him to sleep with all of our commentary. So.
That's awesome. I would like to add one last thing, and that is, if anybody's noticed, we're hearing a very consistent message amongst everyone that to me sounds like this is all boiling down to client education and probably education of veterinarians as well. Because I do think we all know that most veterinarians aren't getting much behavior in school. So why would they know how to tell somebody how to train their cat to not scratch? But so these, to me, these are the big messages, and Fear Free is the perfect organization to do it because you are an educational organization. We need that outreach to pet owners, and so they will quit asking for the procedure, I think, when they're well educated enough. And we need to keep educating the veterinarian with, you know, appropriate handouts, appropriate tools, and ways that they can easily educate their clients. And it could make all the difference in the world. It's all about education, I think.
Thank you for that, Dr. Tynes. All right. Oh, just woke up a little bit. All right. Any other closing comments from our panelists or our attendees?
No, I do want to tell a story, and this was I think back in 2010. I was teaching a pain class at the North American Veterinary Conference Institute. You know, it was a 1 week long class, and there was people there from really all over the world. And I had one of the attendees as a veterinarian who came up to me and was like, I'm forced to do declaws. How can I make the cats more comfortable? And so I said, you know, again, you have to have the courage of your conviction to really talk to your boss, but I understand it may be a job. And, so I described how to do a ring block. And there was a veterinarian from India, and she's like looking like this, like a dog that's trying to figure something out. And I said, finally, do you do declaws in India? She goes, well, like if a dog gets the claw caught, we'll take it off. And I said, no, not declaws. And she's like, what? And I said, removing the claws of cats so they can't scratch. I almost virtually had to catch her from hitting the floor. And so, in this country, we really think ourselves as being superior to so many other countries and so many other cultures. And in many ways we are not, and we have to be humble about this. And I thought, here's this country that so many people, look down upon, and yet, it was just anathema to them, the thought of decline. And I think that, as veterinarians, we have to carry that attitude forward. And we have to really have, crunchy talks with our colleagues that really don't want to give it up.
Thank you, Dr. Petty. That's a great story to share, so thank you. All right, Dr. Conrad did write a note in the chat about being listed on the Paw Project as a vet that does not provide declaws. I will be able to follow up with everyone on this call with that information so they can get themselves registered, as more and more cat owners are looking for vets that do not do declaws. So thank you for that reminder, Dr. Conrad. All right, well, Dr. Becker, you want to close this out?
I just want to say, Dr. Conrad, I applaud your tenacity with what you've done, because I know what it's like to not be liked for some stands you take, but you went out when you were alone pretty much, and getting it from all sides. And Dr. Conrad, I've had some discussions about groups that came when Fear Free was thinking about not doing decline 2 or 3 years ago. Some groups really came down on us, and now they don't do decline themselves. And there's use your imagination. There's an association that Dr. Conrad was at their annual conference a few years ago, and when Dr. Conrad sat down at the table with them, everybody at the table got up and left. And if I told you the organization, which I'm not going to say, which unless Dr. Conrad says, it is shocking. And so that's pretty tough to take as an adult when your colleagues and stuff all leave. So, Dr. Conrad, you pushed us over the edge in a really good way. We're not an organization like Association of Feline Practitioners. We're not like AVMA. We're not like AHA. We're a company, we're an education company. But this was very much needed. It's the right thing to do. But moreover, as I've gotten to know you, your passion for this is going to have impacts with sustained ripples globally. And the whole pain issue, Mike, is a big issue that you're going to help us with. And Valarie, you and your colleagues on the behavior side deserve the spotlight, a lot more than you've ever had before. So we're glad to see you up front. And you know, Robin, the same with Mike, looking at things of underdiagnosing and undertreating pain. That was amazing to me to see that cat. It just so happens to happen right before this webinar, but you know, that cat, everybody in town probably hated that cat. And by the way, the owner came in with, had the cat with welding gloves on because they were afraid they were going to get bitten. I guarantee you it's just that that pain that cat's hadn't lived through. It couldn't have changed that fast if it wasn't. I mean, that was really like, you're talking about those monoclonal antibodies, that was like that. But for all you that have embraced fear-free, I applaud you and I thank you. It's really funny. It started out just the right thing to do to match up with our oath. We didn't know it was better medicine, that we could dramatically reduce injuries, easier to attract and retain people, very profitable. We got 2 good white papers out on profitability and fun. You'll be probably happy to know 22 of the 30 veterinary schools now require fear-free certification of all students before graduation. Require. And I can't remember what the Association of Veterinary Tech Educators want to make fear-free certification mandatory for all veterinary technician students by the end of 2022. So they're not going to learn like we did, that pets didn't feel pain, and if they did, it was good for them. That's what I learned. So they're immobile. And I love millennials and Gen Z. When you think about not decline, they're so receptive to us looking after their pet's best interests. You know, I love seeing them in there and the way that they're taking care of their pets. So looks like we're right on the time here.
Looks like Dr. Young has one more comment for us.
Actually, I'd like Dr. Becker to repeat his plagiarized saying because I didn't get it and I want to type it out because it's so wonderful.
Yeah, you know what? And again, I heard it from Julie Reck. It was so perfect that, you know, you hear something sometime you go, God, can I use that? She said, I'm not going to sacrifice your pet's long-term emotional well-being. I'm not going to sacrifice your pet's long-term emotional well-being for the convenience of getting this done today.
Perfect, thank you.
And Karen, I've had shorthand, what I sometimes just say, and even in addition to that, let's come back another day a different way. I mean, that can mean all sorts of things. It may be pre-visit pharmaceuticals, it may be nutraceuticals, it may be compression garments, it may be these times you have set aside for the most sensitive pets. But oh God, it makes you feel so good when, hell, we used to just have those pets all go to the back and everybody dive on them, you know, like for nail trims, you know, and you'd hear it, you'd smell it, smell those anal glands coming out, and horrible.
Well, I want to thank you for Fear Free because we have completely embraced it quite a few years ago, and it has just, for our well-being, I always emphasize that. When you started out with this, you were saying, oh, it will make you, you know, it'll better your practice and you'll financially do better. And we started in on it and I said, I freaking don't care. It helped our emotional well-being, and that was worth every penny.
Yes. Yeah. Thank you.
Yeah. Thank you. Yeah. All right. Well, to Marty's point, we are 1 minute before 9. So probably a good time to wrap things up. We have lots more to come this year with various webinars, support tools for you. If there's anything that you think would be helpful, just go ahead and let us know. You can reach us at wags@fearfreepets.com is the easiest. Most of you have my email as well, which you're welcome to use, which is my first name and my last name, rachel.abrams@fearfreepets.com. And we also have practice certification at fearfreepets.com. So with that, I would say it's time to call it a night and look forward to doing this all again in a couple of weeks, essentially. So thank you, everyone. Really appreciate it.
Bye. Good night. Thanks.
Bye.